If you live in Oklahoma, a group called Save Our State wants you locked down. During times of uncertainty, there are always individuals that will call for ever more government. In the name of safety, liberty must take a back seat. The individuals this time is a group called Save Our State. Now, who is this group? Save Our State is a non-political group that has as its goal to call for Governor Stitt to issue a statewide shelter-in-place order. An order similar to Ohio, Louisiana, and New York. They say this will save thousands of lives. According to the group, if this isn't done, the consequences will be devastating. The group has presented a petition to the governor with 4 main demands. The first one is, follow the lead of the 42 other governors and numerous mayors by amending your safer at home policy to include all Oklahomans across the state. Honor your commitment to transparency and communication and protect public safety by clarifying the definition of essential business and laying out precise requirements for business that remain open during this crisis. Adhere to your promise to be data-driven by extending the order until at least May 18th, after Oklahoma's projected peak, and making a commitment to reassess before lifting the order. Work with your legislative colleagues to leverage the state's rainy day fund to ensure that cuts to essential services are not made in the middle of this statewide emergency. Obviously, I have a few problems with the objectives of this group. According to statements made by some of the people in this group, the governor hasn't done anywhere near enough as far as shutting down this state. They say our shelter in place hasn't been a shelter in place at all. They also say our efforts need to be on par with Louisiana, New York, and Ohio. The problem is we aren't on par with any of those states in terms of the COVID-19. As of April 18th, New York has 240,000 cases, Ohio 10,000, Louisiana 23,000. Oklahoma currently has 2,571 cases. By your standard, Oklahoma isn't doing enough, but we've managed to bend the curve and have fewer infections than any of the states you mentioned in your petition. By your very standard, Oklahoma isn't doing enough, yet we still have fewer cases by far than most of the country. Logically, most would agree our approach to this ought to be proportional to the situation. To date, no state has run out of bed space for COVID-19 patients, including Oklahoma. Oklahoma, for its part, only has 228 people currently hospitalized for COVID-19. The number of hospitalizations have been so low, in fact, that some hospitals have been forced to shut down. The governor has even brought back elective surgeries to deal with this matter. This does not sound like a state in the midst of a health crisis. This state, according to your standard, failed to shelter in place, and we are still managing to bend the curve. In fact, the majority of people who've caught coronavirus in Oklahoma have recovered. Now, compared to other governors, Governor Stitt has been hands-off in a lot of the mandates compared to other states. How has that panned out for Oklahoma? Pretty good so far. We somehow managed to bend the curve even while not taking the draconian actions of this group. Let me be clear. The position that Save Our State has taken is not the moderate position. This isn't the position of the experts in Oklahoma or the CDC. The positions taken by this group appear to be based more on fear than evidence. Overreaction instead of proportionality. Governor Stitt, on the other hand, has chosen to move forward on the 3-phase approach presented by Donald Trump in the federal government. The plan that has the stamp of approval of Anthony Fauci and Deborah Birx, 2 of the leading experts of this coronavirus in the United States. It is also backed by governors, business leaders, and health officials across the country. Daily testing has peaked at around 150,000 people per day, and that is expected to double in the coming weeks as we move into phase 1 of this process. The CDC has mobilized experts to go to every single state that is coming online in the phase 1 and to track the progress as they progress. Before moving through different phases of the plan, the states have to meet certain metrics. Also, more antibody studies continue to come out, and they show that the coronavirus may be way more widespread than we ever knew. There are 3 studies and more to follow that suggest COVID-19 virus may be more widespread than we initially thought. The studies tested the antibodies of a random sample of individuals. None of these have been peer-reviewed yet, but these 3 similar results were held by 3 different groups of researchers. The first is a Stanford study that found that the number of cases in Santa Clara County, California could be 50 to 80 times higher, indicating that between 48,000 and 81,000 were infected as of April 1st. The Boston study tested participants in a homeless shelter and found that the infection rate among them was 36%, with only 7% having a slight cough. The third study, also from Massachusetts, estimated that 30% of those tested in the town of Chelsea could be infected, with almost all of them showing no symptoms. These studies lend credence to the idea that the virus has a very high rate of asymptomatic infections, while making the fatality rates orders of magnitude lower, with some saying it may not be much higher than the flu. Now, this isn't the only study happening in the world. Germany has an ambitious study they have taking place right now, a small sampling of people, of German citizens, and they will be tracking them over a year to see how they progress and to test for things such as this. This theory isn't conclusive yet, but the data looks promising. It's important to keep in mind that this is still a virus without a vaccine or any official treatment. Antibody tests like this continue to show that the rates of infections are far higher, pushing down the fatality rates and furthering the theory of herd immunity. In light of all this, it is clear that the mission of Save Our State is not only regressive, but foolish. This isn't about the people. This is about pushing back on a regressive mindset that has as its mission to paralyze the working people of this state. As we continue to see historic unemployment numbers in this state, we understand that Oklahomans have to be given the opportunity to get back to work. This isn't an argument about jobs versus lives. This is an argument about lives versus lives, livelihoods, homes, families, and things like that. Whether it's suicide, drug and alcohol abuse, or divorce, these outcomes will result in the deaths of hundreds of thousands of people if Save Our State is granted their wish of shutting down this state for an extended period. Look, there are costs associated with either path we take as a state. If you don't like Governor Stitt's plan and it terrifies you and you have the luxury to do so, stay at home. But the rest of us Oklahomans, we're going to get back to work and making Oklahoma great. You can follow us on Facebook at 46 News, Red River TV. We post videos every single week, and continue to read my columns at 46news.com. Until next time, we'll see you.